So what we have been discussing today as sort of the future of the field, how things are moving forward, how we are heading to the next level. So we have been discussing about targeting biomarker and how to talk in the language of regulators. And it's going to be important. So it's going to be important for OHPM to be able to communicate with regulatory agencies. And for that specific language for targeting biomarker, we think that AI can contribute in terms of identification, validation, optimization. This is something that we had in Ines' slides. So that's going to come wrapping up the last slide with the slide that Ines started, that eventually we want to identify those biomarkers, validate them, optimize them in the individual level. And using AI tools, potentially we are able to do multi-level data fusion that could give us some composite biomarkers eventually that would have all different dimensions together. And also they can include computational physics models, and they can have data from different levels together. And maybe we can call them mechanistic foundation models, things like that. And then the validation should happen. And this is something that is going to be very critical, very interesting with what we call in silico testing and even in silico clinical trials. When we have many of those virtual brain twins, then we can randomize them in two groups, right? And run a trial and see if the response is going to be different across these two groups, and then actually doing the real clinical trial. So that is the promise of these things, bringing them together. And if we can do them, that is going to be very, very exciting. And then, of course, we always do experimental trials, those we have been discussing today. We all do those experimental trials. Eventually, we need to have randomized clinical trials with cumulative dose and follow-ups, those things that are kind of state of the art of the field to be able to receive FDA approvals. And of course, the last level is the precision. How we can use foundation model and individual data for the next level of development of the protocols, how we can even use those things to develop closed-loop optimization of brain stimulation, and some downstream applications of the field. So, as you can imagine, things are going to be exciting. So, many kind of thanks to my collaborators, and I'm happy to receive questions, and then we will have time to invite all the speakers to sit together here and chat a little bit about what is going to be the future of neuroimaging, neuromodulation, and we are definitely very much interested to hear your opinions about that. Thank you very much.